Today we are watching episode 3 of the PITT on Max. It takes place in the ER. I've worked in the ER for 10 years, so let's watch episode 3.
Okay, let's see. Who's up next at the Deli of Death? Weak and dizzy? No thanks. Flank pain, need a UA first, and buttock abscess. Great teaching case for a student.
Don't make me tell Robbie you're cherry picking.
The Deli of Death, fun. So he's looking at the board, he's looking at people's chief complaints. He's skipping over some of the ones that he doesn't want to do. Flank pain, UA, that's a urine analysis. Anytime someone comes into the ER with any sort of abdominal pain, we have to get a urine analysis. That's a urine test. I cannot tell you how often I have gotten in trouble for forgetting to get a patient's urine sample and then they go pee and then it's lost until they have to pee again. And that's a problem. The urine analysis is a very simple test that tells the ER so many things. And if you don't give it to us the first time, we're gonna have to wait for you to pee again. And you're thinking like, why don't we just give the patient some water and they'll pee again? You can't eat or drink anything in the ER until we know exactly what's going on with you. So it becomes a very long process if we need the urine sample and you've already flushed it down the toilet. If you're a patient and you're coming into the ER for anything, doesn't matter what it is, if you need to pee, make sure you ask somebody who works in the ER if they need a urine sample. They're gonna say yes. They're gonna give you a cup, you're gonna pee in the cup.
I need your pee now.
Where is she?
Oh.
My friend, she's in my car. She won't wake up.
Okay.
Potato, Bernie.
Gurney? What? Oh,
What's your name? Jenna?
Oh yeah, look at that, sternal
Look up
rub.
for me, baby.
Gurney. All right. Yes, this happens. Sometimes the patient can't get out of the car and someone else runs in and says, hey, my family member, my friend needs help. And they always want like, you gotta bring a bed out for me. I never bring the gurney out. Usually I'll just bring the wheelchair because whatever's happening, I can get them into the wheelchair. You don't need a gurney. This girl, I mean, she's small enough where you can carry her, right? Most patients who are coming out of the car don't look like this. Most patients who are coming out of the car are very unhealthy and require a few people to try to get them out of the car and into the wheelchair.
Pupils pinpoint. I need.
Narcan.
Yep.
She's
Okay,
on
back to the body.
drugs. Oh yeah, look at that. Narcan. Spray a little Narcan in that nose. Wake her ass up.
Not responding to Narcan. We might need to intubate.
Not
Find a room and
responding
open a
to
crash cart.
Narcan.
I can't find a carotid pulse.
Oh no. Oh.
Welcome back.
Looks like she did respond to Narcan. That is what happens when you are on narcotics and Narcan wakes you up. It kind of just happens really fast. That's pretty accurate.
What'd you take, Jenna?
Nothing.
You had to have taken something to cause this.
Okay, no, I was just up late studying and I just couldn't fall asleep.
So you took something to help you sleep? We need to know in order to treat you properly, okay?
Yes.
Do you know what she took?
No.
The
Bullshit.
sign is something really serious, and we're gonna have to do a lot of tests that you
Okay,
really
it's
don't...
like half a Xanax.
That's not nothing. It's okay. Okay. You taken Xanax before?
First time.
Yeah, you don't gotta lie. We've seen it all. You're not gonna get in trouble. Not with us. We gotta know what you're on so we could take care of you. Whatever the hell it is. She took Xanax, probably laced with fentanyl, which is why the Narcan worked.
He was your patient, Dr. Whitaker. Would you like to say something before we all take a brief moment of silent reflection?
All right, this doesn't normally happen. Normally you don't have time in the ER to do this. I've only ever had one case where a nurse gathered everybody and was like, hey, we need to acknowledge what just happened here. This is someone's life. Like, let's take a moment of silence. That's only ever happened once. There's no time to. It's sad, but it's true. The ERs are busy, so slightly unrealistic.
If anyone needs to talk about this some more, I'm available.
For now, let's harness some good thoughts here for Mr. Milne.
Yeah, okay. I mean, it's appropriate, it needs to happen. It just doesn't happen that often.
Wait, what happens now? We monitor her heart and breathing for the next few hours to make sure she doesn't need more Narcan.
That's it?
Yeah. You should text your friends. Oh, you should text your whole college. Tell anyone to listen to not take pills without a real prescription unless they want to end up here.
Yes.
Seriously, fentanyl is everywhere. It's in everything on the street these days.
Yes, this came up in the last episode too. Fentanyl is being laced into a bunch of the street drugs, including Xanax. And the reason for that is the seller who laces their Xanax with fentanyl causes the buyer to become addicted. So the buyer will have to keep coming back, making the seller rich.
This is Hank?
What happened?
Oh, nothing. We were just
Right, man, my buddy Joey comes in, he says
Oh.
a guy walks into
All right.
a bar with a nail in his head, and then he points his fucking nail gun at my head.
What would you do? So I freaked out.
Oh,
and
shit.
then in the ensuing melee,
Whoa, there's a
he
nail.
Fucking shoots me.
Melee.
Whoa! First of all, rails on the gurney need to be up. Never push a gurney through the hallways of a hospital without the rails up. Patient could fall. Very dangerous, unrealistic. This would never happen. They'd get yelled at immediately.
Guffle like a Donnybrook. What, you think because I work construction, not a hospital, I don't have a fucking vocabulary?
Tier 1 trauma now?
No, sir.
Whoa.
This guy's very upset.
Cardiac.
I gotta tell you, this fucking hurts.
Let's just try and relax and dial down the F-bombs. We have children in here.
You want me to stop firing? Take the fucking nail out of my heart.
That was my favorite thing to tell patients too, especially in the ER when adult patients become a little too crazy, they act up, they start screaming and yelling. I like to say, hey man, you gotta chill. There's children here. And that usually works. Most of the adult patients will understand like, oh, because of the children, let's just calm down and try to act a little bit more civil. I use that line all the time. Good dialogue, very realistic. Nail in the heart, not that realistic. Never seen that happen.
No, I need a priest here.
Look at that.
Tachycardia with borderline BP. He could
They're doing an
decompensate.
ultrasound of the
Guy
heart,
with 2 units whole blood. Garcia here. Start cardiac.
making sure that it's beating correctly.
Dying here and nobody's telling me.
There is blood collecting in the sac around your heart. You need
Oh,
surgery before
never
your
mind.
heart stops from the pressure around it.
Just pull the fucking nail out.
That would
No.
definitely kill you.
Never pull out anything that you've been impaled by, especially a nail in your heart. Don't pull that out. That is a plug that is now keeping all that blood from coming out of your heart. Also, I guess what she's saying is there's fluid being filled around the sac of the heart, which is very dangerous, right? The heart beats, bum, 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 bum. If the sac around the heart is being filled, it can't beat that much because now it's being filled with blood and all that pressure is keeping that heart from beating. All bad things are happening for Hank. Never pull out.
Pressure's down, 7238.
Effusion is grown. Now with RV collapse. Pericardiocentesis.
Get another unit on that infuser.
Prep for thoracotomy. All right, there's no way. A thoracotomy, again, it's another one of those very rare procedures that happens in the ER. What they're gonna do is cut open that chest, break some ribs, get to the heart to release all that pressure from the heart. So remember earlier we were talking about the heart was beating and now it can't beat because that sac around it is being filled with fluid. They're gonna go in and cut that sac, release that pressure so the heart can beat. They have to do that by getting to the heart. You understand what I'm saying? A thoracotomy, they're gonna cut open this person's chest, use a machine to break open the patient's ribs, get to the heart and fix the heart here in the ER. That is a very rare procedure, a thoracotomy, okay? I've only ever seen one. No, that's not true, I saw two. I saw one my very first week in the ER ever. I was like 17, 18, and then I saw another one probably like 6 years later, and then I never saw another one after that. This is pretty crazy. Let's see it. All right, here we go. Yep. So they're cutting right below the heart. See, there's the nipple.
That's
Dr. Santos, how do we cut through the intercostal?
They're gonna fucking.
through the superior rib to avoid the neurovascular bundle.
That's great.
Finish on a retractor.
There it is. See that little machine? Right there. They're gonna crank. They're gonna break all those
Full
ribs.
suction. Get rid of this nail before I get poked. On it.
Oh, they're also gonna take the nail out because now, yes, okay, look. See that? They're gonna take the nail out. Now it's a good time to take the nail out because they can go in, the patient's sedated, and they can go in and they can sew up that little hole in the heart too. Or maybe she'll just stick her little finger in there, keep it from bleeding, and take them up to OR. But I think more likely she's gonna sew up the little hole. And she's gonna cut the sac right outside the heart to release all that fluid and let the heart beat.
Nails intact. In one piece.
Two forceps.
She has to check if the nail is intact in one piece, because if the nail's broken, then they got to go find the other piece that's in the heart, which is extremely dangerous.
Single puncture wound to the left ventricle. You've got a finger on it.
First unit is in. Pressure's up.
Heart is feeling well. Throw in the horizontal mattress and we're out of here.
Stop the bleed while I sew.
She's gonna sew it. She's gonna sew that little hole back together. Okay, yeah, thoracotomy. It's called cracking the chest. In the ER, that's what we call it, cracking the chest, a thoracotomy. Literally cut you open, cut through your ribs, break all those ribs apart to get to the heart, take that little sac on the heart, cut it, release the fluid, and then in this case, pull the nail out, sew that little hole in the heart, stabilize them, and get them upstairs to the operating room. That's crazy. Does it happen? Yes. Does it happen often? No.
Mr. Gellan, you're having a very big heart attack right now. Major artery that carries oxygen to your heart is almost totally blocked.
That doesn't sound too good.
No, it's not very good.
Isn't that interesting? He's having a total heart attack right now, but he's still awake and talking to us, which can happen. There are some patients who will walk in with a heart attack and not know it. They'll be like, I have a little pain right here. We'll do an EKG and they have a full-on heart attack. And some patients come in, they're already passed out and they have a heart attack. It presents differently. This is realistic.
We're gonna send you up to the cath lab. A cardiologist is gonna unblock that with a balloon and leave it open with a stent.
But I'm still having a heart attack?
If everything goes as planned, it'll be like you never had a heart attack. We're gonna put a catheter in this artery right here. We're gonna shave the hair with a clipper.
Yes.
Stop short of a Brazilian.
Yeah. So if you come in with a heart attack, what they're gonna do is go through your femoral artery, which is right between your legs, near your groin. Before you go up to the cath lab to get the catheter inserted to fix your heart, I, in the ER, have to shave that area very clean before we send them up, because the people upstairs don't like when you send their cardiac patient upstairs still hairy in the femoral artery area. We get in trouble. I have shaved many femoral arteries, seen a lot of junk. So, very realistic. Aw, look at that. They got a uniform machine.
Hey, there's no scrubs in here.
Yeah, you have to put your old ones in before it'll give you a new pair.
Yeah. This is cool. We had these during COVID. It's a little machine where you would come in and put in a code to get scrubs. And the idea is that you could come in with your regular clothes, get some scrubs, put the scrubs on, and then go to work, get infected with COVID, take all that clothes off, come back, return it, and you'd get your credit back. Pretty cool. It's the reason I have these scrubs, actually. This is the reason I started wearing these scrubs, because these are the type of scrubs that would come out of this machine. They're kind of considered disposable, but they would come out of this machine. That's where I got these. Ah, little scrub machine. Realistic. Never seen one before on TV. Brings back memories. COVID memories.
Mr. Quinn, this is Dr. Robbie.
Hello, sir. How you feeling? The crap? When did your palpitations start? A little while ago.
We interrogated his smartwatch. His heart rate's only been up for 92 minutes.
You understand we need to shock your heart back to normal? It's gonna hurt.
He'll be sedated.
Oh yeah, look at that.
Now, 75 of propofol, slow IV push.
How much did you vape last night?
A couple of pods.
You vape every day?
I do, but not that much.
Want to cut back?
I try, but it's just really fucking hard.
How much nicotine is in a pod? Anybody know?
No idea.
40 milligrams, same as a pack of cigarettes.
Wow, 2 packs in one night.
Wow, look at that, dropping the knowledge. I love this show. Yes, vaping is bad for you. It is still nicotine. Good job. They're gonna shock this guy. He's awake, he seems healthy, but his heart's acting haywire, so they're gonna have to shock his heart back to a normal rhythm.
Mr. Quinn. Mr. Quinn. Okay, he's out. Sync cardioversion at 200 joules.
Oh, look at that. They were kind enough.
Charged. Clear.
They were kind enough to put him out before they shocked him. I've seen patients with cardiac issues who we will shock when they're awake. Very painful. They were nice enough to put him to sleep. Good job, PITT. And also kudos for just the subtle advertisement of how bad vapes are for everybody. Don't do it. It's bad for you. I don't care what they're advertising it as. Vaping is not good for you. Ah.
Ready to go inside?
Okay, that's nice.
No, not really.
They have a visiting room.
I'll be with you. You can decide when you want to leave.
I didn't know we had a, does every hospital have a visiting room? I don't. Again, the rails, the fucking rails. The patient's rails are not up on the bed. I know the patient is dead, but a gurney with anybody in it should never not have the rails up, especially if nobody's working on them. If you walk away from a gurney with a patient in it, both rails gotta be up. That's crazy. Put the goddamn rails up. That's twice now in this show. PITT, what are you doing?
Did you know those things would kill you?
Not that lucky.
Hey, they're stealing our rig!
Oh shit.
Did you leave the keys in it?
Always, in case somebody needs to move it.
Yeah, you probably shouldn't have done that. Why don't you come on inside, Ziegler? We'll look you over.
All right, yes. Not realistic. I used to drive ambulances. I would never leave the key in the ambulance in case somebody needed to move it, because stuff like this could happen. Someone could steal it. That's a little unrealistic. We're not leaving our keys in the ambulance for someone to move it just in case. If the ambulance takes up space, the other ambulance will find a different place to park and come in. Not that realistic. Also, again, do you see that little subtle PSA that cigarettes and nicotine kill? Love it. Cigarettes and nicotine, bad for you. Overall, I feel like the PITT, again, is still very realistic, but it's starting to get unrealistic. This is the third hour of this shift. okay? And so far, we've had a thoracotomy, a dead guy in the hallway, and a stolen ambulance. And on the last episode, it's the same day, there was a cricothyrotomy. That's too much. That is too much in one shift in the ER. If you get a cric and a thoracotomy, crack in the chest in one shift, like that's enough. You're not doing anymore. Like there's no way they both happen in the same day within the same 2 hours. Pretty unrealistic. Shout out to the PITT for highlighting the social worker and all that they do, because they are very important and we need social workers in the ER. They do so much. You could also highlight some ER techs and respiratory therapists. Haven't seen those guys yet, but I'll take what I can get. What else? The debriefing after a patient passes is pretty unrealistic. It doesn't happen that often in the ERs I've worked at. There's just no time. What I really love about the show is also the PSA about fentanyl and how dangerous fentanyl is in our society right now. That shit is everywhere and it is killing people. So shout out to the PITT for highlighting the fentanyl crisis. I still love this show. It's becoming a little bit unrealistic, what with the fucking bed rails and all. Minor details that I'm sure only I'm going to notice. So far, still a really great show. Can't wait to watch the next one. Hope you guys tune in. I'm also currently on tour right now. Ticket links and dates are in my bio. Please come to a show. I would love to see you guys. Thanks for watching.